and elevation, which margin up to 50 degrees. This is the motion of the shoulder girdle, pivot of the sternoclavicular joint. The clavicle fracture represent 5% of all cases and 44% of fractures with the shoulder girdle. This have a bimodal age, أقل من 40 above 70. طبعا اللي أقل من 40 هيبقى high energy trauma, اللي above هيبقى low energy trauma. Emin classified 1967 into the medial third is group 1, the lateral third is group 2, the medial third is group 3. Because the clavicle related to the chest, lung, and breast, so metastasis can occur in the clavicle, so you can have a pathological fracture of the clavicle. Also, you can have a stress fracture of the clavicle. How a stress fracture occurs to them? What is the mechanism of a stress fracture of the clavicle? How do you use the clavicle so frequently that you have a stress fracture? The most common is something called neurological tick. Some people have a ticking. Okay. When the bone is fractured, the sternocleidomastoid pulls on the medial fragment medially, while the pectoralis and the vitals are only inferior and anterior. Physical examination is very simple, protruding bone, painful, ecchymosis. But the most important is if you find a progressing hematoma, you may suggest there is subclavian injury, or this if there is subclavian injury, you may have the blood pressure difference, pulse difference, and so on. Also, neurological examination is mandatory. Okay? For conservative treatment, more than 200 modalities for treatment of simple fracture. This indicates that this fracture is difficult to reduce and maintain for a long time in such simple case. In a study for operative versus non-operative treatment of mid-shaft fracture, which is displaced, we have to differentiate between undisplaced fracture and displaced fracture. Undisplaced is benign and you can treat it conservatively. The displaced, according to the degree of displacement, you may do surgery. They found that of non-operated cases, there were 14.5% cases of non-union and 8.5% of symptomatic malunion. Not all malunion is symptomatic. While for the operative it was 1.54% cases of non-union and no cases of malunion. To revise the natural history of fractured clavicle, revising 868 cases, we found that the most common incidence of non-union is 6.2, but the most cases which have non-union is displaced mid-shaft fracture, which is almost 15%, and the distal, which is the lateral part, is 11.5%. The incidence of non-union is higher in advanced age, lack of cortical apposition, female gender, and comminution. Again, revising the natural history of the clavicle fracture, you will find that a diaphyseal fracture in old age, which is displaced, have a higher rate of non-union. In general, non-operative treatment is adopted by many authors because the surgery is finis implication. Okay? You may do surgery which you may gain nothing, and you may do conservative and you gain everything. So, for time being, we keep the surgical indication for these indications. Open fracture and bending orbit associated neurovascular injury, post-neurovascular repair, floating shoulders, scapulothoracic dissociation, and if there is association with red fracture. Okay. This is floating shoulder, okay, and this is a bony floating shoulder. Difference between this floating shoulder, this is ligamentous floating shoulder, and this is bony floating shoulder, and this is scapulothoracic dissociation. Of course, these injuries high energy trauma, and the patient mostly in intensive care. If you decided to do surgery, you have to plan your surgery. We found that the upper surface is the best surface which resists bending cantilever effect. Okay? Compression plate is better than recon plate, and locking is of minimal interest. Locking is not good, and intramedullary fixation will not control rotation with the movement of the patient. In the study of biomechanical evaluation of different blade configuration, for the fracture, it was found that the double mini blade is the best construct. Okay? This is the one which will take all the loads. During surgery, you have to place your surgical incision just anterior to the clavicle, not on the clavicle. Yes,
الصورة اللي أنا معلش. الصورة اللي قبلها معلش. عملت دي إيه؟
double plate.
double plate العادي يعني.
double mini fragment plate. You place the incision just anterior to the clavicle, not on the top of the clavicle. You have to protect the supraclavicular nerves. You have to do preliminary fixation, and you have to identify the acromioclavicular joint by needle. You have to use a good